blood pressure affects about a quarter of all adults in the UK. It's a leading risk factor for heart disease or stroke and costs the NHS about £1 billion a year in drugs alone. Currently, most patients found to have high blood pressure for the first time are given a formal diagnosis if their blood pressure is raised at 2 subsequent visits to the doctor. They may then be prescribed medication to lower their blood pressure. Research suggests, however, that about a quarter of patients actually have white coat hypertension, where blood pressure is raised temporarily due to stress. Now, the National Institute for Health and Clinical Excellence, NICE, has advised doctors in England and Wales to move towards ambulatory monitoring of patients at home, using a device that automatically takes blood pressure readings every 30 minutes, day and night. Around 1 in 10 GPs are already offering ambulatory monitoring, either directly or by referring patients to a hospital specialist. In this programme, we hear the views of daytime television GP Dr. Chris Steele, who explains what high blood pressure or hypertension actually means and what to do if your blood pressure is constantly higher than the recommended level. We also hear from Richard Cardo, General Manager at Rudolf Reister, who discusses why the measurement of blood pressure is the main focus of his company's research and development efforts.
Well, blood pressure is a normal reading in your body. Blood pressure itself is not a disease. We all have to have blood pressure. And what it is, your heart's a pump about the size of your fist, and it contracts and squeezes blood out into the arteries that carry the blood all around the body to all your organs. And when that blood enters the arteries are elastic, so the blood is coming out of the heart under pressure, and that's creating pressure in the arteries. And if they're elastic, they can expand, and then the blood flows quite easily. But as we get older, the arteries get a bit harder, and the pressure can increase because you're pushing the blood through an artery that's not expanding. So the pressure inside does increase. And that leads to high blood pressure, and high blood pressure is implicated in heart failure, heart attacks, strokes, kidney disease, etc. And with high blood pressure, the frustrating thing from a medical point of view is most patients with high blood pressure don't feel it. The condition of high blood pressure is called hypertension medically. And most people just don't feel high blood pressure until something goes wrong or until it's checked by a nurse, a doctor or a pharmacist.
What I know about blood pressure is one of the things about blood pressure is that if your blood pressure is too high, it's associated with heart disease. My blood pressure is pretty okay, but I try to do exercise. But unfortunately, I don't do enough exercise. I should do more exercise to keep it under control.
High blood pressure medically is called hypertension, and it's a level of blood pressure above a certain agreed limit. Now, this is where you come to problems, because the guidelines now for what is defined as high blood pressure, the levels are coming lower and lower. It used to be blood pressure that was over 150 over 90. Now, let me explain those readings. When the doctor tells you your blood pressure readings, he gives you 2 figures. Say 150 over 90. The top one is called your systolic blood pressure. That's when your heart is contracting. And the second figure, 90, is your diastolic figure, which is when the heart is contracting. So you always get these 2 figures given to you. Now, the guidelines at present, they're coming down, and we're looking now at levels of 130 over 80 as being the upper limit of normal. And above that, it's classed as mildly abnormal, and of course if it's higher, it's severely abnormal. So the doctor has to decide, does he treat you if your blood pressure is over 130 over 80? And in fact, some very hot research has only just come out in the past day or so, and that is regarding the measurement of blood pressure. When a lot of people have their blood pressure measured by a doctor or nurse, it's actually elevated. We call it the white coat syndrome. I know if I go and get my blood pressure checked by a colleague, a GP, I'm feeling slightly tense, and it's higher than it should be. So we're getting readings that actually are not the true level for that patient. Now, up to the present moment, the way I've done this, I've checked the patient's blood pressure. If it's seen to be over the upper limit of normal, so over 130 over 80 now, I would actually ask them to come back 2 or 3 times, let them rest, and have it checked, say 3 times, and take an average of the 3 readings. Or I would tell the patient, I suspect you might have high blood pressure. Why don't you buy a do-it-yourself blood pressure kit from your pharmacist? Right? You know, you needn't spend a lot of money, and then measure your blood pressure yourself at home. You measure it in the morning, the afternoon, and the evening. Take 2 or 3 readings each time, and you're going to get their real blood pressure. They'll get used to doing it. They're going to be relaxed at home. There's no stress and no tension.
Rudolf Riester, formed in 1948. A German company, German family-owned company until recent times, in 2007. We've always been at the forefront of medical devices in innovation. Blood pressure was the very first lineup because of our research and very close professional work with scientists, doctors and patients, in fact, around the world. We've been able to bring to the market-leading technology, innovations which they've asked for. And this is due to the fact that we have a very strong sense of a German engineering and a can-do attitude here in the factory. The first product lineup was the blood pressure devices, which Riester had been known for worldwide for accuracy and durability. In fact, all of them have British Hypertension Society validation, which no other company has for the whole range of blood pressure devices. We also have fully automatic bedside monitors for vital signs. We have otoscopes, not ophthalmoscope, diagnostic stations. We have lighting, which has LED illumination, all of which comes with the German stamp of engineering all the way through it. Everything's made here in Germany with good German quality, so durability and accuracy is a given. We also have a lot of innovations in the pipeline which have come from extensive research with both hospitals and doctors worldwide, and I'll share these with you now. The first one I would say is the British Hypertension Society approved and validated blood pressure devices, ranging from a small palm style device to the most recognisable Big Ben device, which has been in the market for a number of years and has proven accuracy and lifetime technology which actually exists in all of our blood pressure devices. What that means for you, the customer, is you can use it day in, day out without the need to replace any components because of the lifetime technology we provide. The latest innovation in our blood pressures is the introduction of the new shockproof device. This is a device which is used extensively in doctor surgeries and can be used every day with the knowledge that actually it can withstand an impact from a fall of up to 3 foot and it will remain in calibration and no need to replace or repair. We're so confident about this device, we've actually included a 5-year warranty with no questions asked as standard. But blood pressure is not the only innovations that we have. We've also got a new major innovation with our LED illumination, which is available in both our otoscopes, ophthalmoscopes, and of course our lighting. LED illumination is the future. It's the key to clean, accurate diagnosis in both the eye and the ear. We realise that, and with our extensive research with both the patients and the doctors and the medical community, we've introduced a brand new product to the market, the world's first pocket diagnostic set, that's the otoscope and ophthalmoscope, with LED illumination, which actually provides up to 5,500 Kelvin, which is almost as similar to the sunlight, natural sunlight, which of course is the best way of observing particular conditions. The important message about the e-scope is it's powered by normal AA batteries. There's no requirement for rechargeable batteries, so therefore you can expect to get at least 20,000 hours from the bulb itself and up to a much longer operational time with your normal AA batteries. So we're offering bright illumination for very good effective cost value for use in the product. And they're available in 2 colours, so you can use white or black. So they're the two major innovations that we've introduced to the market, but of course we don't stop there. We have a very good history in a number of other products which sit alongside blood pressure and otoscopes. A good example of that, in fact, would be our extensive range of wall-mounted diagnostic stations, which allow you, the customer, to make up your own mind about flexibility and what you want to do. We call it the reformer. Basically, what it gives you is a centerpiece which is powered by electric, so there's no need for batteries, so therefore it's plugged straight into electric mains, with two handles. And on those handles you can put an otoscope, an ophthalmoscope, or two ophthalmoscopes, and you can extend it for a further 4 handles to give you a complete diagnostic station. You can add thermometry to the mix, you can add the Big Ben to the mix, which is the aneroid BHS validated device. So this is again a proof of our research and feedback from the market, who said they would like flexibility and accuracy all in one diagnostic station. So rather than having to go to this drawer for the blood pressure device and this drawer for this otoscope, you now have it all in a nice packaged wall-mounted device with BHS validated blood pressure and LED illumination, which no one else can offer at this stage in time. Our most recent innovation, which has come from extensive research globally with the hospital market and health professionals worldwide, is the ReVital vital signs monitor. This is a device which can be used in a hospital or a clinic environment to test the vital signs of each patient, whether they're mobile or in a bed. Now what that means is blood pressure, SpO2, and in some cases temperature. All of these devices can be added to the main unit. The key message on this, it has British hypertension validation naturally, and it can be used from neonatal up to large adults. So we cover the whole range available. It also has shock-proof technology, very similar to our shock-proof blood pressure device. So using a very busy hospital environment, you can be sure of its accuracy and its durability because of the shock-proof technology. And of course, it comes with the standard German engineering quality. Thereby, it's very reliable, very robust, and available on a number of mounting options, whether it's on a caster base or a wall-mounted unit. And of course, the ReVital comes with the standard German quality engineering, which allows you, the customer, to have the confidence in using it either on a mobile stand, wall-mounted or desk-mounted. Rudolf Riester will continue to be innovative and bring market-leading products to both the hospitals and the doctors worldwide. We're able to do this because of our relationship with you, the professional, with your feedback. We've already implemented many changes, which are leading to your life being a bit easier with accurate devices, which are easy to use. We welcome your feedback and continue to look forward to it and working with you in the future.
High blood pressure can be caused by many different factors. Obviously, it's more common as you get older, so age is a factor. And as you get older, you get hardening of the arteries, so there's a factor. Being overweight is a factor, being a smoker is a factor, excess alcohol is a factor, other things in your lifestyle such as high salt intake and unhealthy diet is a factor. I mean, even a low intake of fruit and vegetables is a factor for hypertension. And then also, I mean, just ethnicity. High blood pressure is more common in Afro-Caribbeans. It's a genetic thing. It might be genetic with you in that there's a family history of high blood pressure. So, you know, there are many factors. Now, I think basically what you should think is your age, you know. You can't do a thing about your age. You can't do a thing about your family history. So these could be warning signs that you might be at risk. And basically I would say, look, I would say if you're over 40, know your numbers. And the numbers you should know are your blood pressure, because you won't feel it. Most patients with high blood pressure don't feel it. The other numbers you should know your cholesterol, because you won't feel that. And also know your sugar level. That's a sign of diabetes, because you won't feel that either. I'm a keen advocate of people knowing the numbers, especially from the age of 40 onwards. Everybody should know the numbers.
Maintain a healthy blood pressure is, what I do basically is exercise a lot and basically eat the healthy foods.
When I diagnose high blood pressure in a patient, the first thing I talk about is lifestyle. Before we talk about medication. I mean, I would investigate them further, various blood tests, and also assessing their kidney function. But lifestyle is so important. So if they're overweight, they've got to lose weight. If they smoke, they've got to stop smoking. They can have alcohol, but if they're a heavy drinker, they should restrict alcohol. If they're a heavy consumer of caffeine, they should restrict their caffeine. Now, even if they're not overweight, but they're not exercising, they should exercise. And by exercise, I don't mean, you know, getting in the Lycra gear, going to an expensive gym. You go out for a walk, a 15-minute walk. That's all I'm asking you to do, non-stop, as slow as you want initially. Turn around and come back. You've actually done 30 minutes. And you should try and do that every single day. Now, there's no such thing as bad weather. There's only bad clothing, right? So it costs you nothing. You've got a pair of legs, put some shoes on, go out. 15 minutes, turn around and come back. I helped a patient, a viewer of This Morning, to lose weight. He was 45 stone and he lost 30 stone, documented on television over 12 to 18 months, and all he did was walk each day and restrict his fat intake. Nothing else. No drugs, no surgery, and he lost 30 stone. So, you know, it's good for vanity, it's good for your figure, good for your appearance, but very good for your health. Not just high blood pressure, but other conditions that can adversely affect your body.
As we've seen, ambulatory blood pressure monitoring at the time of diagnosis of high blood pressure would allow better targeting of treatment and is cost effective. Ambulatory monitoring is already available in some general practices, and we've shown that its widespread use would be better for both patients and the clinicians looking after them. Treatment with blood pressure lowering medication is usually lifelong, and so it's worth getting the decision to start right in the first place. Some 12 million people are diagnosed with the condition, and it's estimated another 5.7 million people have it but are unaware. It's a major risk factor for heart disease and strokes, so it's crucial we do all we can to get people diagnosed and properly treated as soon as possible. When you offset the costs of ambulatory monitoring against the reduced treatment costs of people who don't require treatment and the reduced number of visits to doctors, it's estimated that the NHS within about 4 or 5 years will save £10 million. So it's a win-win situation for patients because it's a better way of making a diagnosis and the NHS actually saves money. I'm Georgina Burnett and you've been watching Blood Pressure in the NHS.